Thanks, Greg. According to the National Diabetes Statistics Report, diabetes is the leading cause of new cases of blindness among adults, and 38% of the adult U.S. population has pre-diabetes. April 1st was Defeat Diabetes Day, and today Dr. Mark Stevens of Key-Whitman Eye Center joins me to shed light on how diabetes can affect your vision and, more importantly, how it can be treated before it's too late. Before it's too late being the key words, right?
That's right. Thank you for having me.
Good to see you. Okay, so we know that uncontrolled blood sugar levels can lead to a lot of issues for people. How does diabetes affect the eye?
Well, what research has shown is that after about 10 to 20 years of having diabetes, a majority of people have diabetic changes in the eye. And if we catch those changes early, usually we can prevent any sort of vision loss in the future for people.
So you're talking about catching the symptoms early. What are the symptoms that a diabetic should be aware of?
Well, what's dangerous about the disease is usually people don't notice anything until very late in the course of things. And so if we're able to catch these symptoms early or catch the signs early, we may avoid bigger surgeries, more invasive treatment. It's why people's primary care doctors get onto them so much about getting their yearly eye exams when they have diabetes.
So that's something. So what you're saying, I think, is it's something you're going to be more likely to pick up in an eye exam, more likely than catching a symptom.
Absolutely.
Is that right?
Yes, absolutely.
Okay, so it's an important reason, especially if you're a diabetic, to have that annual eye exam. Is there a relationship between diabetes and cataracts?
There is. So everybody that lives long enough ends up with getting some cataracts. When you have diabetes, we tend to see that process earlier, and the cataract tends to progress a lot quicker. We end up treating it the same way as you would an age-related cataract, and we've performed thousands and thousands of those surgeries.
Yeah, I wasn't aware of the connection between diabetes and eye issues. I know that you talk a lot about how important eye exams, that annual eye exam, is for everybody because you pick up things early enough that you might not pick up otherwise, right?
Correct.
And when do you recommend people start getting those?
We recommend at age 40, people come in for their yearly eye exam. Not only if they have diabetes, but we're able to pick up early glaucoma, early cataracts. We do our cancer screening, autoimmune type screening. So very important once you hit 40 to come on in for an exam. So
what do viewers specifically with diabetes need to do?
Well, they need to call and get an appointment. We have 9 locations throughout the Metroplex. I practice at our Rockwall and Richardson locations. I perform all my surgery at our Dallas office.
It's great to see you. Thanks so much for good information this morning.
Thank you so much.
Call 214-220-3937. That's 214-220-EYES, 214-220-3937, or visit keywhitman.com for more information. Paige?